Laura is a really, really happy baby. She is very attached to my husband and I. She loves to, look at other people and smile and giggle as long as she's, as long as she can see my husband and I in the same room. She was born on a Sunday. Fine when she was born. Yeah, fine. Came out screaming. She was born with a little dimple on her back, but then at 4 months old, she started to develop a little birthmark. It's called a hemangioma, and it's what people call a strawberry birthmark, right below the dimple.
What you worry about is if you have that skin marking, that there might be something underneath that or in the spinal cord. One of those conditions is where there is some fat cells that get stuck inside the spinal cord, and as that baby or the fetus is growing in the uterus, that fat continues to grow and gets stuck within the spinal cord.
There's a chance that if we did not get it taken care of, if the spinal cord was being continued to be stretched, that you could have a child that could have trouble walking, pain if she tried to walk, and then be confined to a diaper for the rest of her life.
Fortunately, with MRI that we have available to us today, we're able to diagnose it at such a young age.
She was 8 months old when she had the surgery.
We have to actually make some cuts in these bones with a power saw. Then we lift these up, and then we see the covering of the spinal cord and nerves. We open that, and then using the microscope, we see the spinal cord and we see the fat. And we're just going in there and vaporizing, and we're just burning away the fat. During the operation, we're actually monitoring her motor and her sensory pathways that are going down her spinal cord and coming out through the nerves, and we're also monitoring her bladder function, that we know she's going to be able to go to the bathroom without any problems.
She did great from the surgery. Dr. Jallo was very happy with, her movement. She was moving her legs right after she, came out of anesthesia. We didn't expect her to recover that fast. So she was crawling like, almost 3 or 4 days after the surgery, which was phenomenal for her. As far as watching the tethered cord, she'll go for an MRI in about maybe 3 months, and then she'll have another MRI every year until she stops growing. Dr. Jallo said she should develop just perfectly normally.
If it was my child, I would bring my child to Johns Hopkins Children's Center to undergo this procedure, just because I know that that is the one center that has the technology and the skill to use that technology to do such a safe operation.
What impresses me most about the Children's Center is the staff, and how friendly they are, how they communicate so well, and how organized they were. They were just on top of everything immediately.
We are probably the only center in the United States that does research in spinal cord tumors.
It was a no-brainer to go to Johns Hopkins Children's Center. People come from all over the country and all over the world to have surgeries because of the level of care that is provided. It is an institution where you have the most up-to-date information, the most up-to-date interventions, and so if she was going to have surgery, I wanted it to be provided by the best hospital I could possibly go to. If I was to choose to go anywhere, I would choose to go to Hopkins.
I'm hoping one day it could be put out of business because I'll be able to find ways to treat these disorders in a less invasive fashion.
They gave me back my happy baby. She's here, home with us, and we're able to care for her and get on with our lives and get back to being a family, which is so special to us because that's all we want. I just can't thank them enough for giving me my child back.